Hello everyone, I am Dr. Vidhu. Today we will discuss adverse event following immunization. So start with the definition for this question. So AEFI is defined as any untoward medical occurrence which follows a immunization. So AEFI is defined as any untoward medical occurrence which follows immunization. This can be unfavorable or unintended sign, symptoms, disease, even the lab findings, any abnormal lab finding. Okay, this is the definition of AEFI. Next, we'll go on to the classification of AEFI. So, among the classification, it is divided based on three methods. So, it is classified based on three methods. Among this, first one is based on underlying association. Second one is based on the severity of events. Third method, it is based on the frequency of occurrence. Okay, first we'll look into the underlying association. So based on the underlying association, this AEFI is classified into 5 types. The first type is vaccine product related. In this vaccine product related, it is caused or precipitated by the inherent properties of the vaccine despite the correct preparation, handling and administration. This is caused or precipitated by one or more inherent properties. Vaccine product despite the proper administration or proper preparation, starting with it, proper preparation, proper administration and proper handling of vaccines. For example, the limb swelling following the DPT vaccine administration. Okay. The second type here is vaccine quality defect related. So in the vaccine quality defect related, it is because of one or more quality defects of the vaccine product, even including the administration device. It is mainly provided by the manufacturer. Okay, so it is because of one or more quality defects of vaccine product. It even includes its administration devices, because some vaccines come in pre-filled syringes. which are provided by the manufacturers. For example, the inactivated inactivated polio vaccine, if the inactivation is not complete, that is failure of by the manufacturer to complete inactivate the inactivated polio vaccine, this leads to the paralytic polio. So this is an example for the vaccine quality defect. Third one is immunization error related. In immunization error related, this should be a completely avoidable one. Why? Because this is mainly because of inappropriate vaccine handling, prescribing and administrating. So in inappropriate vaccine handling can be due to the cold chain defects. If the cold chain is not maintained properly, you can have this type of AEFI. It is inappropriate vaccine handling, inappropriate administration, inappropriately prescribing. Okay, so this can be example, transmission of infection by a contaminated multiple dose vial. Okay, example for this. Or inappropriate cold chain. Transmission of infection by a contaminated multi-dose vial. Okay, this is the third type. Fourth one is immunization anxiety related. It is not because of the immunization, it is anxiety about the immunization. That is, they are going to prick the child. So sometimes the child will be anxious about the pricking. Okay. Or vasovagal syncope can be caused in an adolescent during following the vaccination also because of the anxiety. It is anxiety about the immunization. Okay. Fifth type is, it is coincidental. It is a temporal association. It is caused by some other thing other than the vaccine product, immunization error or immunization anxiety. It is caused by something that is other than vaccine product, immunization error or immunization anxiety. So these are the 5 types of classification under underlying association of AEFI. Second category, based on severity of events. So based on severity of events, it is classified into 3 types. That is minor, severe and series. In this minor, it is all the local reactions like pain, swelling, redness, and it also includes systemic reactions like fever more than 38 degrees Celsius, irritability, so which can be managed by antipyretics and anti-inflammatory drugs, and it also resolves within 2 to 3 days. Okay, so we'll have this diagram. So first one is minor. Minor reactions include local and systemic reactions. Local is like pain, swelling and redness, while systemic like fever more than 38 degrees Celsius, irritability. So these can be managed by antipyretic and anti-inflammatory agents, and which resolves within 2 to 3 days. Okay. The second one is severe. So the severe can be a disabling one. Severe types include this can be a disabling one. But it do not lead to a long-term problems. But this must be immediately reported. Severe is a non-regulatory term, while that of serious is a regulatory term. It is any untoward medical occurrence that at any dose which results in which results in death, or which results in inpatient hospitalization or prolongation of existing hospitalization, or it is precipitating or having a significant disability which is very life threatening, or it can leads to a congenital anomaly also, which causes a persistent or a significant disability, which can also lead to congenital anomaly. So these are included under the serious category. So based on the severity of events, it is classified as minor, severe and serious. This is for based on severity of events, the classification for AEFI. Next, based on occurrence, frequency of occurrence. So based on frequency of occurrence, here too we have 5 categories. One can be very common. Very common is like fever occurring after following the pentavalent immunization. Very common, common, uncommon, rare and very rare. So we have percentage. When the symptoms occur more than or equal to 10%, it is very common. Or when it is between more than or equal to, when it is between more than 1 but less than 10%, it is common. Or when it is more than 0.1 but less than 1%, it is uncommon. Or when it is more than 0.01 and it is less than 0.1, it is rare. Or when it is less than or equal to 0.01%, it is very rare. This is based on frequency of occurrence. So this is about the classification of AEFI. Next we will discuss about how they are going to report the AEFI. So reporting of AEFI, it is a flow chart. It should flow from the health worker, that is even from the ANM. So reporting of AEFI, because they are in the field level workers. So it starts from the ANM, then to the in-charge medical officer in the PHC, then to the district immunization officer, then state level, then national level. So when it is a serious AEFI, so when it is a serious AEFI, how they will react. This should be reported immediately within 24 hours. Okay, it should be reported immediately within 24 hours by the in-charge medical officer in the form of case reporting format. The case reporting format, it should be reported immediately within 24 hours to the to the district immunization officer. From the district, it should be reported immediately again within 24 hours to the state and also to the national level. And this should even be reported by a weekly block register based reporting system. It should be reported even in weekly block register based reporting system, and also through a monthly reporting system, that is monthly HMIS. Okay. Next, if it is a severe AEFI, in severe AEFI, this should also be reported through a weekly reporting and monthly reporting system. If it is a minor AEFI, it should be reported in a monthly reporting system. Okay, so in monthly reporting system, even if it is nil, it should be mentioned. So even if it is that minor AEFI, so even the nil AEFI should be reported. Okay, we'll see the flow chart now. So it starts from the health worker, that is ANM, to the medical officer. In the PHC, it should be reported from medical officer to the district immunization officer, within 24 hours. This should be reported in the, as I have told earlier, this should be reported by a case reporting format. Okay. From here, it should be reported to the state and also to the national level immunization. Okay, this should be reported, that is CRF. It should be reported within 24 hours. Next, from the district they'll be going to the field to look for the type of vaccine, type of the which person is being injected, the nature of the person, if he is having any previous history of any diseases, and the vaccine type, the batch number of the vaccine that is being administered. So they will prepare a preliminary report. Preliminary investigation and report will be prepared and submitted. This will be submitted to the state level officer within 10 days. This is preliminary. Okay, and the final report. So after submission of this preliminary investigation and report, within next 60 days, that is a total of 70 days. Okay, so the final investigation and the report will be submitted within 70 days to the state immunization officer and even to the national level. So this takes a total of 100 days from the ANM till the national level. It takes around 100 days for this reporting system to be completed. Okay, so supposing if the person is dead after the administration of the vaccine, the autopsy should be carried out immediately or within 72 hours. Okay, so this is about the reporting system. I've taken it in a very simple way. I've not gone into a very detailed way of taking this. So this is just important for your examination point of view. That is, you have to report, the medical officer from the PHC should report it in a case reporting format. The preliminary investigation report should be submitted within 10 days and final investigation report should be submitted within 70 days to the state and also to the national level. Okay, that should be submitted in a CIF form. That CIF form is nothing but case investigatory form. This preliminary investigation and the final investigation report, it will be submitted in CIF format. Okay, this is submitted in CRF. So this is about the AEFI. Okay.